Hi, I'm Patrick McCarthy. I'm the program director for the Pediatric Hospital Medicine Fellowship at the Medical College of Wisconsin.
Hi, I'm Vanessa McFadden. I'm the research director for the fellowship for hospital medicine at the Medical College of Wisconsin.
And we are here today to answer some questions that have been posed about us and our program for prospective applicants. I guess we can go ahead and dive right in. So question number 1, can you please introduce yourselves? I don't know, Vanessa, do you want to go first?
Sure. So, like I said, I'm the research director for the fellowship. I'm also one of the associate section chiefs for pediatric hospital medicine at Medical College Wisconsin. One of my interests is research, obviously, and so my research is mostly focused on adolescents and how to provide sexual and reproductive health care while adolescents are hospitalized.
Well, I guess it's my turn. So again, I'm Patrick McCarthy. I actually have been at the Medical College of Wisconsin now for a couple of years and have been working extensively over the last couple of years in helping to develop our fellowship program. That is actually one of my academic interests, which is curriculum development, program evaluation, and other areas that I'm interested in fall within the realm of medical education, including provision of feedback for learners and faculty development surrounding provision of feedback. So those are areas that I continue to hope to explore more over the next few years. So question number 2, why did you come to Medical College of Wisconsin and Children's Wisconsin? Well, I came here in order to, number 1, join a growing and dynamic section of hospitalists that provide excellent clinical care for children. Number 2, I really was excited to help take on a leadership role within the fellowship and help develop our Pediatric Hospital Medicine Fellowship. That's been something that has really been an exciting endeavor, which has helped me to learn a lot about our institution, more about curriculum development, and more about the ACGME accreditation process. So that's been very useful and has helped me grow. And then most importantly, number 3, I am from Wisconsin and a lot of my family lives nearby, and it was great to actually be able to have an opportunity to move a little bit closer to be able to spend some more time with them.
Well, for me, I actually came to Medical College of Wisconsin for my residency for pediatrics. I still remember my residency interview and knowing just right from that day that this would be a great place for me and I would love it, and I was right. My favorite part about Medical College of Wisconsin and our program is that is the people. We have a fantastic group of people, and I'm just continually impressed by how smart and innovative and just well-known in their field people are, but yet willing to take time out of their day to support and mentor each other. And that's just an amazing place to have role models here. Additionally, I really like working at a place where sayings such as providing best and safest care and coming from curious seem to really mean something to the people that work here, and that makes working really a delight. After residency, I ended up staying for my chief year and then joined the hospital medicine group, and I couldn't be happier.
All right, so next question. What do you like about working at Medical College of Wisconsin and Children's Wisconsin?
I really like our group. I think exactly what you just said. I think our group really celebrates each other's victories and supports each other through difficult times. And I truly believe that that's one of the reasons why our fellowship is going to be great, because the environment is just such a great environment for growth and success.
I agree. And I feel like clinically, we really have an opportunity to see a very wide breadth and depth of patients, patient populations, everything from general sort of bread and butter bronchiolitis down to very medically complex children like most hospital medicine programs do. The thing that I really enjoy about providing care for children in that setting is that we really do have a great collaborative group also of multidisciplinary professionals, everybody from our nurses to our respiratory therapists to our subspecialists, to be able to help out and really make sure that we're providing holistic and complete care for the kids that we take care of. And I honestly learn a lot every day from all of my colleagues that I work with clinically. And I feel like that is something that I really enjoy about working in this setting. Moving on to question 4. Question 4 is, what is going to make our fellowship program great or unique? I think you hit on one very important thing coming into this, is that we already have a fantastic group of educators at every level of medical education. Within our section, we have housed already folks who are directors for our pediatric clerkship, for our residency program, and other various educational programs. So I feel like that is something that is a strength that will provide great mentorship for our future fellows in regards to medical education. And we already talked a lot about the engagement of our faculty in various initiatives throughout the hospital, throughout the institution, and even nationally as well, which that experience will also provide a fair amount of mentorship and guidance for folks as they move forward in developing their own individual interests and niches within medicine.
Yeah, I agree. I think the Department of Pediatrics here at Medical College Wisconsin has a wonderful infrastructure already to support scholarly work. So, for example, there is a grants development office that helps you write grants even before, just from the conception phase all the way through submitting it. There's department-wide practice sessions for conferences. There's resiliency coaching, there's a department-wide formal mentoring program. And so I think that infrastructure that's there is really amazing. And then what I find even more amazing is the fact that our leadership in the Department of Pediatrics continues to try to optimize that infrastructure and really try to make it better and more accessible for everybody. And then within our section, we have a wonderful research coordinator, we have a dedicated data analyst, we have multiple hospitalists that are currently accepted to national scholars programs, so including the APA Educational Scholars Program, the Quality and Safety Scholars Program, and then the Research Scholars Program. And I think that's just an amazing way that those people have been accepted into national programs and are really able to use the things that they've learned, the skills and the resources to help others. And I will add too that I feel like any interest that our fellows have, we have other people that have those interests too. So for example, if you think of scholarly projects that our hospitals group are doing, we have some examples are refugee health literacy projects. We have a patient and family-centered rounds initiatives. We have comparing narrow versus broad spectrum antibiotics for certain infections, phone triage education for residents and increasing their autonomy, qualitative interview studies for adolescents in the hospital about reproductive health knowledge and access to care. And so I just think the variety of interests is amazing.
So our next question is, how will our program prepare individuals as they move forward in their both clinical and academic careers? We have worked hard within the ACGME structure to be able to build a program that had all of our required clinical rotations, including hospital medicine rotations, as well as community hospital medicine. We have a very strong palliative care and complex care group here that our fellows will rotate with, and various other subspecialties that will have the opportunity to rotate both as electives and as part of our required rotation. So our goals there really are to give a nice depth and breadth of experience to build upon the experience that fellows had had within their residency programs and really transition to more leadership within medicine, teaching within medicine, and really taking skills and everything to that next level. As far as medical education and leadership, we will have a longitudinal curriculum that will touch on various areas within medical education, including precepting, providing feedback, as well as some basics surrounding curriculum development and design. There's also opportunities to get involved with some of the educational endeavors across the campus that include the Kern Institute's Kinetic 3 program that has a teaching scholars program. That's a 2-year program that fellows will also be eligible to be able to enroll in as well. So that's something else that we're excited to be able to offer for folks who have that specific interest.
Yeah, I think I touched a lot on the academic and scholarly work already. I think one of the other things that shows how recognized our work is the fact that we've had internal and external grants successfully granted to us, and including such grants as multiple American Academy of Pediatric catch grants, so the community access to child health, which I think is amazing.
So last things to touch on, I guess, is what advice do we have for fellows as they're considering applying for our program?
I think one of the things that I talked about is that we have a lot of different interests among our group and among the hospital. And so really trying to think about things that you are interested in and what you might want to do your scholarly work on can be really helpful. And by no means does that mean that you have to have your whole life planned out, nor does whatever you do in your fellowship mean that you have to have that for the rest of your future. But I think coming in with some ideas can be really helpful.
Along that line, I agree. I think what else is important is to think a little bit about what your longer term goals are for your career, so that as you apply and as you look at our program, you will be able to help you understand what opportunities exist here to be able to help you build within that area of interest that you have. For example, if you're interested in medical education, if you're interested in quality improvement, those sorts of things. While everybody will get a little bit of education and a little bit of experience in those areas, if you come in knowing that those are some areas that you want to find out more about, we'll be able to continue to help support that and let you know what we have to offer in those areas. All right, so as we are wrapping up, please know that we are here to answer any questions that you might have, and on our website you will be able to find our contact information as well. Please feel free to send us an email and we'll try to get back to you as soon as possible. So we look forward to seeing you virtually during our upcoming interview season.